I'm here representing the Vermont Academy of Pediatrics and the National Academy of Pediatrics and the Vermont Medical Society. And I think this issue is incredibly important. As Kevin just said, we did pass a bill in this State House a couple years ago. It's my belief that the bill has failed. It was given a chance. It was debated. And I think we have proof now that it didn't work. And the idea then was parents could make good choices if they got good information, and in fact they would vaccinate their children to prevent diseases. And we've just been unable to do that, and that's actually been shown elsewhere. I believe that if we look at diseases like measles, which now is kind of hitting the headlines and everything else, and may in fact reach Vermont very soon because it's in states around us, we actually have put children at risk by not vaccinating them. But important to me is the fact that if we look at what vaccines actually do, they have reduced childhood diseases by up to 100%. There's nothing else we do in medicine where we 100% of the time improve people's health. Our present law has not worked. Again, our present law has not worked. The rates of unimmunized children have gone up. More children are at risk today than they were 2.5, 3 years ago when this law was passed, and we need to understand it. I think it was given a good shot. I think the State Health Department, I think the politicians, I think the parents involved on both sides all gave it a good shot, but it doesn't work, so it has to be relooked at. As a pediatrician, I'm in this room speaking for children and families, but I will always state that I'm speaking for children first. My job is to protect and care for children and to make sure that they're healthy and in the healthiest environment possible. If we have, and I looked at the statistics last night, there's one school in the state that has about 30% of children immunized. That school and all those children and anyone else they're connected with who's unvaccinated are at risk for all these diseases, and obviously measles is at the top of that list. And I want to end by underlining the fact that this is a public health issue. This isn't about parental rights. If we allow children to be unvaccinated when children out there are going to be at risk of contracting the disease who either can't get the vaccine or, as we know, vaccines aren't always protective. They go through all the steps, they get the vaccine, and they're one of the few that don't respond to it. So that parent has done everything that's right for their child, but their child gets sick because another parent decides not to even give that child a chance. Thank you.